detailed and alert. Respiratory illness activity is rapidly increasing across the United States. Yet, vaccination rates for COVID-19, influenza, and respiratory remains low. Millions of people get sick in the next month or two. Medical research indicates that COVID infections, even asymptomatic ones, often lead to long-term health impacts. As a novel virus, the long-term impacts of multiple COVID infections are still largely unknown, and prevention is strongly recommended. As hospitalizations increase, and the CDC has warned healthcare systems that emergency departments and hospitals will face heavy strains due to their capacity, prevention is key to ensure this does not happen. IDPH has already strongly urged reinstating masking in all healthcare settings. Healthcare settings such as hospitals, outpatient clinics, dental clinics, patient-facing labs, pharmacies, long-term care and short-term care facilities must follow these recommendations to protect healthcare workers, patients, visitors, and our families. Wearing masks in healthcare facilities or getting vaccinated now for COVID, flu, RSV will prevent thousands of new Illinois hospitalizations in the next month and save lives. While IDPH recommending masks is a step in the right direction, the pre-COVID Illinois Public Health Act allows for mask requirements to protect the lives of public health workers and patients, to prevent the surge in COVID, flu, and RSV infections and hospitalizations from getting worse. Healthcare facilities should not be able to opt out of life-saving infection control. And thank you. This is a joint effort by the People's Response Network, Care Not COVID Chicagoland, and the Chicago chapter of National Black Nurses Association. So our first speaker is Nurse Vanessa Willis from the Chicago chapter of National Black Nurses Association.
Thank you. Good morning. My name is Vanessa Willis, Vanessa Willis, and what a great initiative to get this rolling again. As Lynette has already said, we're already hearing from Illinois Department of Public Health that the numbers are going up. I work in a long-term care facility off and on, and I still wear a mask. I know when they stopped it, but it's time. It's time again. If the numbers are going up, people need to be concerned about wearing the mask. And we're giving away free masks, and you would be surprised at the number of people that are saying, oh, I'm okay. But when the numbers go up and they shut us down again, then they won't be saying I'm okay. I wish I had been wearing a mask. So if you're interested in getting some of these masks for your organizations, please feel free to contact the People's Network. This is a reality, and we've got to accept that this is happening. And we've got to be prepared for it and try and prevent it from happening as bad as it did before. Thank you. Thank you for coming, and thank you everyone here.
Woo! Thank you, Vanessa.
Our next speaker is Dr. Myra Celestine from the Chicago chapter of National Black Nurses Association.
Hi, and good morning, everyone. I'm so happy to be here to pass out these masks and just reinforce the use of universal masking in healthcare. It's important that we have our patients safe and keep our patients safe, and we don't want this infection to keep going. Healthcare providers need to stress the fact of wearing a mask and wear a mask themselves and practice safe, effective hand hygiene.
Yes.
And social distances. Since it's been lifted, people are coming closer to each other, and this is increasing the rate of infections. So we need to be cognizant of that and keep going with the mask. Don't give up on that. So anyone interested, come out, get an N95 mask.
Yes, right mask.
and give care, not COVID.
Thank you, thank you.
Our next speaker is Hannah Hoffman, a long COVID patient, and she represents Care Not COVID Chicagoland.
Yeah.
All right, I'm lowering this down.
I can grab that.
Oh, it's all good. I
Don't
got
worry about it. You gotta see your face.
Thank you. Oh, I really appreciate it. Thanks. Well, that's fantastic. Thank you. My name is Hannah Kaufman, Hannakaufman, and I suffer from long COVID. I'm out here today because it's imperative that Pritzker and IDPH stop ignoring us and take the simple step of bringing back universal masking in healthcare. Before I caught COVID in January of 2022, I could run up a flight of stairs 2 at a time. Now, nearly 2 years later, much of my life involves strategizing about stairs. I still have to stop and catch my breath after every few slow steps. I pack to go up or down the one flight of stairs in my house like I will never be returning, because sometimes I can't. I keep lists of what I need to do on different floors so I don't waste a trip when my memory can't hold on to important things like it used to. On my better days, my husband and I have tried out different ways he might be able to carry me up the stairs to bed. But when the worst days come, I am too weak to hold on to him and too exhausted to lift my head for him to pick me up. So I sleep downstairs those days. There are days when I haven't been able to lift a glass of water to my mouth. I have felt nauseous and shaky for most of the last 2 years. Often the only food I can truly tolerate is white rice. I can't regulate my temperature and swing wildly from too hot to too cold. If I hadn't gotten this stool that I'm sitting on right now, I would not have been able to get the latest COVID vaccine because standing in line at the pharmacy would cause me to nearly faint from my heart beating so fast. I used to be a dancer, but long COVID took that from me. I spend most of my days lying down. My dreams have become small. When a therapist asked me recently to visualize a happy fantasy world, I saw a blank, silent room with a giant bed where I could simply rest. I look healthy to you now, but I will collapse when I get home. My health inevitably worsens when I leave the house more than once or twice a week. If I weren't able to work from home, I would never have been able to keep my job. What hurts more than the illness itself, though, is how little people like Pritzker are doing to prevent it from happening to others.
Yes.
1 in 5 COVID infections leads to symptoms lasting more than 3 months and an average of 10 days off work, 18 for people with underlying conditions. People are losing their jobs, their homes, their relationships. And still, when I go to hospitals for tests, treatments, and even clinical trials meant specifically for people facing long COVID, there are almost no masks in sight. Some of the appointments I have waited 13 months to go to. Some of the procedures I can't wear masks during, so I am relying on other people to do so to protect me. Some of the providers are the only ones who specialize in what they do, so I have to hope that if I ask them to mask, they won't retaliate by taking away my only chance at accessing medications I need to be able to be upright for some of each day. My story will happen to so many people during just this winter surge alone, just in Illinois, on Pritzker's watch. As always, the most vulnerable are the most affected. With long COVID, though, everyone is at risk, and 90% of long COVID cases start, like mine did, with a so-called mild acute infection. Everyone needs protection. So many people have become disabled since 2020 that the census is literally trying to change its definition of disability to make the numbers look 40% lower than they actually are. Instead of trying to pretend this mass disabling event isn't happening, Pritzker could choose a different way forward. Here in Illinois, Pritzker has the power to protect patients and healthcare workers alike by enacting common sense reform calling for universal masking. And we have the resources to provide masks here in Illinois. This is not Gaza, where Palestinian men, women, and children are currently unable to access even the most basic health care because of Israel's continued merciless bombing and sniping of hospitals. Here in Illinois, Pritzker has the power right now to save lives at any moment by reinstating universal masking in healthcare settings. Something simple, affordable, and necessary. Every day, Pritzker chooses not to use that power and allows hospitals to opt out of critical basic infection prevention. Pritzker chooses to have more blood on his hands.
Woo! Thank you, Hannah.
Sorry about that.
Thank you so much. Our next speaker is Emma Wilson. She represents Care Not COVID Chicagoland.
Yay. Hello, I'll be reading comments from folks who are unable to make it today, who are part of Care Not COVID Chicago. First comment is, I'm disabled and immunocompromised, and since healthcare facilities abandoned the protection of universal masking, I've been forced to ration my healthcare. I have had to either cancel or postpone, and postpone and postpone numerous times. For example, I desperately need to see I don't even know what this word is, periodontist. Anyone? Since it appears I have the beginnings of gum disease starting. Periodontist, thank you. But seeing one now without dental offices being required to mask would be tantamount to suicide. My father has cancer. He commutes to Chicago regularly for medical appointments that he is unable to forego. His hospital touts that the oncology floor still requires masking, but in truth, they're forcing cancer patients like my dad to walk through the lobby, down hallways, stand in elevators, and use bathrooms surrounded by people who aren't masking. You see, vulnerable people are everywhere. We don't only need the oncology floor. We need to go to the dentist. We need to see our primary care physician, our dermatologist, our gynecologist. We need to pick up prescriptions from pharmacies. We need emergency root canals. We have a civil right to safely access all of these places and services. During an airborne pandemic, that means we need the protection of universal masking. Comment number 2. My daughter is immunocompromised. My husband and I are also a high-risk group. It's very uncomfortable to have to request my health practitioner wear a mask. Recently, I was asked at the hospital as I was registering if I preferred my practitioner to wear a mask. I was grateful and I said yes. When I got to the exam room, she was not wearing a mask. And when I pushed myself to ask her about this, she said she never got any message about my masking preferences. At the front desk, I mentioned what had happened, and they were completely dismissive. The onus should not be on the patient, and there should be universal masking in healthcare so that these snafus do not happen. Comment number 3. As a minority and person of color who works in healthcare, the COVID pandemic has impacted me and my family greatly. It is a struggle to encourage my colleagues to mask up even when they are aware of constant COVID outbreaks in the healthcare setting. Already, the patient and clinician relationship is a power dynamic. If we truly cared about our patients, we would take every step to respect them and protect them, especially during this current period of high COVID transmission in the community. Some complain that it creates a barrier, but in reality, they have spurned basic infection control precautions merely out of convenience, not out of care for their patients or each other. Healthcare and medicine has had a difficult few years, but I ask my colleagues to continue to strive for the best and do no harm. During this holiday season, I would like to keep myself safe so I may be able to rest and celebrate with my loved ones without infecting them with COVID. As a healthcare worker, I ask healthcare systems to reinstate universal masking. And I have a fourth comment from Eric Stein. We all deserve to be protected and safe when we seek healthcare. The persistent failure of most healthcare facilities to deploy universal masking, preferably N95s, has resulted in an unsafe healthcare environment that has forced me to avoid care for all but the most urgent situations since 2020. These are not theoretical concerns. I have every reason to believe that one of my close relations was sickened with COVID, which then spread in their household due to the lack of precautions in a specialist surgery setting this past year. The IDPH has recommended masking again. They should have never dropped their recommendations in universal masking. They should have never been discontinued in any way, in any healthcare setting in Illinois, anywhere. We do not make hand washing optional when MRSA cases are low. It makes no sense to take a tool that we all know works to improve patient safety and toss it aside. Put your masks back on. We all need you to take some basic actions to make us safer, most importantly with universal masking in healthcare facilities. Do the right thing. Give us care, not COVID. Thank you.
Thank you.
Great.
Our final speaker is Dr. Howard Ehrman. Dr. Howard Ehrman is a former Chicago Assistant Health Commissioner.
Yes.
Thank you very much. First and foremost, as a co-founder of the People's Response Network, we really want to thank the Black Nurse Association and Care Not COVID for not just coming out today, but beginning to work with us in the long term. Our goal is simple. We're going to bring together more organizations and individuals to do the right thing, including demanding that the governor of this state and the director of the Illinois Department of Public Health immediately reinstate mandatory masks in healthcare facilities. We're standing in the largest healthcare campus in the United States. During this press conference, dozens of people have gotten infected with COVID, either here at the hospital, in their two big outpatient clinics, at the Veterans Administration, or at Cook County Hospital. This is not a hypothesis, this is a fact, because 95% of healthcare workers and patients are not wearing masks. Yesterday I was a patient over here, pre-cataract surgery. I counted 69 people. 5 people were wearing a simple surgical mask, and I was the only one with an N95 mask over 2 hours. So that's the situation. What does this mean? It means that we have to work together with those at highest risk, like the people who have come down today to speak truth to power, to basically say to the person who controls this hospital, who's the same person that controls our state, Governor Pritzker. Governor Pritzker is chairman of the Board of Trustees of the University of Illinois, under which this hospital, this clinic, and every hospital and clinic in the state fall under. And basically, he has to work with the director of IDPH to immediately reinstate these mask mandates. We have a situation where at least 51 counties, that's half the counties in Illinois, have a surge, not just in COVID, but in flu and RSV, when flu vaccinations are down 20% around the country. Right now, there are 25,000 people hospitalized with COVID in the United States, and 200 to 300 people dying in under statistic sources from the Center for Disease Control. As mentioned previously, we have at least 60 to 70 million people in this country, at least, who have long COVID. It's completely underreported. People are not able to get care, and then when they do get care, they're exposed again to COVID and other respiratory diseases. Lastly, 3 days ago, the Chicago Department of Public Health issued an alert that we have 400 new cases of chickenpox. And we, since November 1st, have been under a measles outbreak in the county of Cook. Measles and chickenpox are many, many times more communicable, more easily spread than COVID, flu, or RSV. So this is not just about these 3 diseases. This is long-term to protect people from this. And come April and May, when the fires start again in Canada, it's to protect people from something even more deadly, smoke. So we welcome all of you to join with us. We don't have all the answers, but we know we have to keep going. Thank you very much. Any questions?
I have a question actually for you.
Okay.
I spoke with the University of Illinois Health yesterday.
Okay.
And one of the things they had mentioned was that CDPH currently ranks Chicago as a low-risk zone for COVID,
Right.
Which they say is part of why they haven't introduced a mask mandate. What do you say to that?
Yeah, well, as I think everybody here knows on our side, what happened is that the federal government, under the Department of Health and Human Services, under Director Becerra 2 years ago, changed the whole definition of what's low, what's medium, and what's high. The numbers they use are not based on reality. because there's complete underreporting of infections as well as hospitalizations. Just to give you one example, if I have diabetes and I get COVID and I'm hospitalized here, 99% of the doctors are going to say I'm hospitalized for diabetes. And the federal government, including the CDC, no longer accept the fact that I really got COVID. That's why I'm here. So the idea that it's low contradicts even the CDC's own data that said that we've had an incredible surge in COVID. So we don't wait till everybody gets sick. We act before people get sick. That's the idea of wearing masks.
Yes, yes.
Any other questions for anybody else? Or?